As we grow older, conversations about the final stage of life often feel uncomfortable, even frightening. But understanding what may happen in the last year of life is not about fear. It is about awareness, dignity, and peace. Many seniors and families wish they had known earlier what signs to look for and what truly matters when time becomes precious. One common sign in an elderly person's final year is a noticeable decline in energy. Activities that once felt easy, walking short distances, cooking simple meals, or even holding long conversations can suddenly feel exhausting. This is not laziness or depression alone. The body is gradually conserving energy as it slows down. What every senior should know is that rest is not weakness. Listening to the body and allowing yourself to slow down is an act of wisdom, not surrender. Another sign is reduced appetite and weight loss. Many elderly people worry when they no longer feel hungry or begin to eat very little. Families often push food out of love, thinking it will restore strength. In reality, the body naturally needs less fuel near the end of life. Seniors should know they are not giving up by eating less. Comfort matters more than calories. Gentle foods, favorite tastes, and shared moments are far more important than full plates. Increased sleep and withdrawal from social activities is also common. An elderly person may sleep much more than before and show less interest in gatherings, phone calls, or hobbies they once enjoyed. This does not always mean sadness. Often, it reflects an inward focus, a natural turning toward reflection and rest. Seniors should know it is okay to choose quiet over noise and peace over busyness. This time is not meant to be rushed or filled with expectations. Another sign can be frequent illnesses or slower recovery from minor health issues. Infections, falls, or small medical problems may occur more often and take longer to heal. The immune system weakens with age and resilience decreases. What seniors should understand is that constant medical intervention is not always the answer. Asking questions, understanding treatment goals, and choosing comfort-focused care when appropriate can bring more peace than aggressive procedures. Emotional changes are also common. Many elderly people begin thinking more about the past, expressing regrets, seeking forgiveness, or wanting to reconnect with loved ones. Some may talk openly about death, while others become unusually calm about it. This is often a healthy emotional process. Seniors should know that sharing memories, saying what needs to be said, and expressing love are powerful gifts for themselves and for those they leave behind. Finally, a deep sense of acceptance often appears. This is not the same as hopelessness. Many people in their final year show a quiet understanding that life is reaching its natural close. They may simplify their needs, give away belongings, or speak about being ready. What every senior should know is that acceptance can be deeply peaceful. There is strength in letting go and dignity in facing life's final chapter with honesty and grace. The most important message for every senior is this: the final year of life is not only about endings, it is also about meaning, connection, and comfort. It is a time to prioritize peace over pressure, relationships over routines, and presence over possessions. Knowing the signs does not shorten life. It helps us live whatever time remains with clarity, courage, and compassion. As people grow older, one of the most noticeable and meaningful changes that can appear in the final year of life is a sudden and ongoing loss of energy and physical strength. This decline is often different from the normal tiredness that comes with aging. An elderly person who was once able to manage daily routines may begin to struggle with even simple tasks, such as standing up from a chair, walking across a room, or lifting light objects. Movements become slower, balance feels uncertain, and the body seems to tire much more quickly than before. This change can happen gradually, but for many seniors, it feels surprisingly fast and unfamiliar. What is important to understand is that this loss of strength is not a failure of willpower or a lack of effort. The body, after many decades of work, begins to naturally slow its systems. Muscles weaken, the heart and lungs work less efficiently, and recovery after physical activity takes much longer. Even after a full night's sleep, an elderly person may wake up feeling exhausted. Simple activities that once brought joy, gardening, walking outside, visiting neighbors, may now feel overwhelming or even impossible. This shift can be emotionally difficult. Many seniors feel frustrated, embarrassed, or guilty about needing help. They may worry about being a burden to their family or losing their independence. What every senior should know is that needing rest and assistance is a normal part of this stage of life. Rest is not giving up. It is the body's way of protecting itself. Pushing too hard can actually increase the risk of falls, injuries, and serious health complications. This period calls for kindness toward oneself. Slowing down, taking frequent breaks, and choosing comfort over productivity becomes essential. Seniors should feel empowered to say no to activities that drain them, and yes to what brings peace. Family members should also understand that encouragement should not mean pressure. Gentle support, patience, and presence matter more than motivation speeches. Most importantly, this loss of energy can be a reminder to focus on what truly matters. When physical strength fades, emotional strength often becomes clearer. Conversations, shared memories, quiet moments, and expressions of love take on greater meaning. The body may be growing weaker, but the value of the person remains unchanged. Recognizing this can bring dignity, acceptance, and a sense of calm during one of life's most sensitive transitions. As people enter the later stages of life, especially in the final year, eating habits often change in ways that can worry both seniors and their families. A noticeable reduction in appetite and unexplained weight loss is very common during this time. Foods that were once enjoyed may no longer taste the same, and even small meals can feel heavy or unappealing. An elderly person may eat only a few bites and feel full, or forget meals altogether because hunger signals become weaker. This change is usually gradual, but it can feel sudden and alarming to those watching from the outside. It is important to understand that this is a natural physical process, not a sign of stubbornness or neglect. As the body slows down, digestion becomes less efficient, metabolism changes, and the need for calories decreases. Organs are working more gently, and the body no longer demands the same fuel it once did. Forcing large meals during this stage can cause discomfort, nausea, or even distress. What many seniors struggle with most is the pressure to eat normally to please family members, even when their body is clearly saying otherwise. Emotionally, eating less can be confusing for seniors. Food is deeply connected to routine, culture, and social life. When appetite fades, some elderly people feel sadness, guilt, or fear, wondering if this means something is seriously wrong. Others may feel misunderstood when loved ones insist on food as a solution to everything. What every senior should know is that eating less at this stage does not mean they are giving up on life. It simply means their body is shifting its priorities. Comfort becomes far more important than quantity. Small portions, favorite foods, soft textures, and warm drinks often bring more satisfaction than full meals. Eating for pleasure rather than nutrition alone can restore a sense of control and dignity. Sharing food as a moment of connection without pressure can be far more meaningful than counting calories or weight. Unexplained weight loss can also affect how seniors see themselves. Clothes may fit loosely, strength may decrease, and the mirror may reflect changes that are hard to accept. During this time, kindness and reassurance are essential. The body may be changing, but the person's worth, wisdom, and presence remain unchanged. This stage of life invites a shift in focus, from fueling the body for activity to nourishing the spirit with comfort, peace, and understanding. Recognizing this can ease fear, reduce conflict, and allow seniors to live their remaining time with greater calm and dignity. As people reach the later stages of life, especially in the final year, it is very common for them to sleep much more than they used to and gradually withdraw from social activities. An elderly person who once enjoyed long conversations, family gatherings, or daily routines may begin spending many hours resting or sleeping during the day. They may cancel visits, stop answering phone calls, or prefer quiet solitude over interaction. To family members, this can feel worrying or even hurtful, but in most cases, it is a natural and meaningful change, rather than a sign of rejection. The body at this stage requires more rest simply to function. Energy is limited, and being awake, talking, or engaging with others can feel draining. Sleep becomes the body's way of restoring what little strength remains. This increased need for rest is not laziness or depression by default. It is part of the body's natural slowing process. Seniors should know that listening to this need for sleep is not something to feel guilty about. Rest is essential, and resisting it often leads to confusion, weakness, or increased discomfort. Social withdrawal often happens alongside this increased sleep. As physical strength fades, attention naturally turns inward. Many elderly people begin reflecting on their lives, revisiting memories, and quietly processing emotions. Loud environments, constant conversation, or busy schedules may feel overwhelming. Silence and solitude can bring comfort and clarity. This does not mean the person no longer cares about loved ones. Often, it means they care deeply, but no longer have the energy to express it in the same way. Emotionally, this shift can be misunderstood. Seniors may feel pressure to stay social, to reassure others, even when it exhausts them. What every senior should know is that it is okay to choose peace over participation. Short visits, gentle conversations, or simply sitting together in silence can be just as meaningful as long interactions. For families, understanding this change is crucial. Instead of forcing engagement, offering presence without expectation can bring comfort. Sitting quietly, holding a hand, or sharing a calm moment can communicate love more deeply than words. This stage of life is not about staying busy. It is about finding calm, comfort, and emotional safety. Increased sleep and social withdrawal are often signs that life is slowing in a natural and respectful way. Accepting this rhythm allows seniors to feel understood and allows loved ones to share their remaining time with greater compassion and peace. As people grow older, especially in the final year, the body becomes more vulnerable to illness and takes much longer to recover from even minor health problems. Colds, infections, falls, or small injuries that once healed quickly may now linger or return again and again. Hospital visits may become more frequent, medications may increase, and each health setback can feel heavier than the last. This is not because the person is weak or careless. It is because the body's ability to repair and defend itself naturally declines with age. The immune system slows down over time. It becomes less efficient at fighting infections and less responsive to treatment. Healing processes that once worked smoothly, such as repairing tissues, regulating blood pressure, or restoring strength after illness, begin to take much longer. What used to take days may now take weeks, and sometimes full recovery never truly happens. This can be deeply frustrating for seniors who remember a time when their bodies bounced back easily. Emotionally, frequent illness can bring fear and discouragement. Seniors may feel trapped in a cycle of doctor visits, tests, and medications, wondering why their health never seems to improve. There may be guilt about relying on others, anxiety about becoming a burden, or exhaustion from constant medical attention. What every senior should know is that slower recovery is not a personal failure. It is a natural stage of life, and expecting the body to perform as it once did only creates unnecessary suffering. This period often raises important questions about treatment choices. Aggressive medical interventions may prolong discomfort rather than improve quality of life. Many seniors find peace in shifting focus from fixing everything to managing comfort, pain, and dignity. Understanding one's options, whether that means palliative care, comfort-based treatment, or fewer hospitalizations, can give seniors a sense of control during a time when their body feels unpredictable. Frequent illness can also serve as a quiet signal to slow down and reassess priorities. When health becomes fragile, moments of rest, emotional connection, and inner peace often matter more than medical results. Gentle routines, familiar surroundings, and supportive companionship can provide more healing than any medication alone. While the body may struggle more during this stage, the person's worth does not diminish. Slower recovery and frequent illness are signs that life is changing, not that it has lost meaning. Recognizing this can help seniors and families approach this time with patience, understanding, and compassion. As an elderly person enters the final stage of life, emotional changes often become deeper and more noticeable. One of the most meaningful signs is a strong turn toward emotional reflection, acceptance, and letting go. Many seniors begin thinking more about their past, revisiting memories, relationships, successes, mistakes, and moments that shaped who they are. They may talk more about childhood, loved ones who have passed away, or important life events. This reflection is not dwelling on the past out of sadness alone. It is often the mind's natural way of making sense of a long life. During this time, emotions may surface that were once pushed aside. Some seniors feel the need to express regrets, ask for forgiveness, or forgive others. Old conflicts may suddenly feel heavy, while unresolved feelings come to the surface. What every senior should know is that this emotional processing is healthy. Speaking honestly, sharing memories, or even sitting quietly with one's thoughts can bring relief and closure. There is no need to rush this process or avoid it out of discomfort. Alongside reflection often comes a quiet acceptance. Many elderly people begin to acknowledge, sometimes without saying it directly, that life is approaching its natural end. This acceptance does not always come with fear. In fact, many seniors describe feeling calmer, lighter, or more at peace than they did in earlier years. Worries that once felt urgent, money, status, daily stress, begin to lose their power. What matters most becomes simple: comfort, love, and peace of mind. Letting go is another powerful part of this stage. Seniors may start giving away personal belongings, organizing important papers, or talking about their wishes. Some may withdraw from future planning or long-term goals, focusing instead on the present moment. This is not hopelessness. It is a natural release of attachment to things that no longer serve them. Letting go can be deeply freeing, even though it may be misunderstood by others. Emotionally, this stage can also bring tenderness. Seniors may become more open with affection, gratitude, or quiet goodbyes. They may say things they never said before or express love more openly. Families often remember these moments as some of the most meaningful conversations they ever shared. What every senior should understand is that emotional reflection, acceptance, and letting go are signs of inner strength, not weakness. This stage of life is not just about the body slowing down. It is about the heart finding peace. Allowing these emotions to exist without judgment can bring dignity, closure, and a deep sense of calm during life's final chapter.